Every day, you're just wading through this huge wave of health info, right?
Right.
And it's really tough to cut through all that noise to find what actually matters, especially with complex stuff. So that's kind of our mission here in this deep dive. We take a whole stack of sources, articles, research, and we try to pull out the most important nuggets of knowledge for you. Today, we're doing a deep dive into endometriosis. It's a chronic inflammatory condition. And we're also looking at infertility, which often, goes hand in hand with it. Now, conventional treatments exist, of course, but we're seeing a lot of people, a real shift towards exploring complementary approaches too.
Definitely. And the sources we're diving into today, they give a really thorough look at how things like acupuncture and herbal medicine are being used to support people dealing with endometriosis and infertility. We'll even look at one specific pioneering center that's been integrating these methods for decades now. The goal really is to understand the potential benefits and maybe more importantly, the how. The mechanisms behind these approaches.
Yeah, that sets it up perfectly. So first we'll unpack what endometriosis actually is, then look at why these complementary therapies are getting so much attention lately. We'll dig into how acupuncture and herbs are thought to work, the specifics, and then, like you said, look at this real-world example, this center that's been doing this integrated work for ages.
Okay, so let's start with the basics, just for anyone who might not be familiar. Endometriosis. It's a chronic inflammatory condition, basically a tissue that's like the lining of the uterus. It grows outside the uterus. You might find it on the ovaries, maybe the fallopian tubes, other places in the pelvis.
That's right. And the tricky part is this tissue, even though it's in the wrong place, it acts like the normal uterine lining. So it responds to hormonal changes month after month. And that can lead to ongoing inflammation, pretty intense pain sometimes, scar tissue, and as you said, real challenges with fertility. So, yeah, a lot of people start looking for other options, maybe for more symptom relief or perhaps a less invasive approach than, say, hormone therapy or surgery. Right. That search for relief may be something less invasive. It often leads people towards traditional Chinese medicine or TCM. Acupuncture, which is a huge part of TCM, has really been getting noticed for its potential with endometriosis and fertility. It's not standard care everywhere yet, but the evidence that's coming out suggests it could be a really valuable addition, an adjunctive therapy.
Exactly. And what's fascinating is how it's thought to work. It's not just about masking pain. The idea is it might actually sort of re-engineer the body's internal environment. Think of stress and inflammation as like roadblocks on the path to conception. Acupuncture seems to act more like a systemic traffic controller. It's not just clearing the immediate jam, but maybe rerouting things for better long-term flow, better health. Specifically, the thinking is it reduces that key inflammation we talked about. It helps with pain, improves blood flow, especially to the reproductive organs, and maybe helps regulate hormones. There was one systematic review, looked at 15 trials, over 1,000 people. It found evidence supporting acupuncture and also moxibustion as alternatives for endometriosis pain. And another review pointed to positive results for pain levels and also for this blood marker, CA-125, which often indicates inflammation or the presence of this endometrial tissue. Seeing that marker go down with acupuncture, that's a pretty direct biological sign of its anti-inflammatory effect.
That's really interesting, seeing a biological marker change. And I saw mention of a specific protocol, too, the Credenda-Magarelli acupuncture protocol, CM8. It seems to focus on very specific acupuncture points during particular phases of an IVF cycle. And this structured approach, well, studies suggested it showed promise for improving pregnancy rates in IVF patients who also had endometriosis, higher rates compared to control groups.
Right. And if you connect that to the bigger picture, the underlying mechanisms are thought to involve modulating the immune system, reducing oxidative stress, influencing that whole communication pathway, the hypothalamic pituitary ovarian axis, the HPO axis. Basically, it's all aiming to create a more favorable environment for conception. And while, yes, we always need more large-scale research, it seems to offer a pretty low-risk option to complement conventional treatment. It's really about kind of fine-tuning the body's own systems.
Okay, so acupuncture is working on these systemic pathways. How do herbal remedies fit in alongside that? That's where custom herbal medicine comes in, right?
Yeah.
Often prescribed in that same TCM framework. Another natural approach.
Exactly. These herbal formulas typically aim to help regulate hormonal cycles, reduce inflammation even further, and just generally improve reproductive health. A lot of herbs have known anti-inflammatory properties. They can directly help with the pain and discomfort of endometriosis, like curcumin, for example. It comes from turmeric. Everyone knows turmeric. It's well known for being potently anti-inflammatory. And research suggests it might help regulate hormones, maybe slow the growth of that endometrial tissue, and soothe inflammation by reducing estradiol production and suppressing how the tissue migrates.
Wow, it's amazing how specific some of these herbs can be. I also saw peppermint mentioned. How does that fit in? Is it just for cramps, or is there more to it with its antioxidant properties?
Good question. Peppermint does have those antioxidant properties, and yes, it's known for easing menstrual cramps, but that broader impact on oxidative stress could contribute to a healthier inflammatory response overall, beyond just cramps. And then there are herbs focused on hormones. Vitex, also called chaste tree, that's traditionally used for a lot of gynecological issues. It might help balance hormones, regulate cycles, potentially improving fertility for women with endo. Then you have something like ashwagandha. That's an adaptogen. It helps the body handle stress. And stress is a big deal with endometriosis, because of the chronic pain and the fertility struggles. So by lowering cortisol, ashwagandha might indirectly help create a more balanced hormonal environment for conception. Which, brings up a really important point for listeners. These herbs, they aren't miracle cures, but they can be really effective for managing symptoms and supporting the body. But, and this is critical, you absolutely need to consult a qualified professional, a healthcare provider or a licensed TCM practitioner. They can guide you on proper dosing and make sure there aren't any interactions. These are potent substances.
That makes total sense. Okay, so with acupuncture and herbs in mind as complementary tools, let's look at this real-world example, the Berkeley Center for Reproductive Wellness. They've apparently been doing this for over 2 decades.
Yeah, and what's really interesting here is the Berkeley Center, founded back in '97, it wasn't just another clinic popping up. It actually holds the distinction of being the very first center in the U.S. to dedicate itself exclusively to integrating these, time-tested Eastern therapies with Western medical approaches, specifically for fertility. So their 27 years of clinical experience, it's not just about being around a long time. It means they've developed some really unique protocols. They have a deep understanding of how these things work together. And they've built strong relationships with leading reproductive endocrinologists, REIs, especially in New York City.
And the founder, Mike Berkeley, seems central to this. His dedication apparently comes from a pretty personal place.
It does, yeah. Before he even became an acupuncturist, he and his wife went through their own infertility struggles. They had several failed attempts with conventional treatments and then found success with acupuncture and herbal medicine. And that personal journey, well, it completely changed his path and led him to specialize in this very specific niche.
Wow. So he really lived it first.
Exactly. And he's recognized as the first acupuncturist in the U.S. to focus solely on fertility issues. Over those 27 years, he's carefully developed his own unique acupuncture protocols and proprietary herbal formulas, always tailoring them to the individual. His whole approach is really grounded in understanding both ancient Chinese medicine and modern Western reproductive science. It's truly integrative.
And it sounds like his expertise is pretty well respected. I saw a quote from a Dr. Paul Magarelli, an ND, praising his talent and contributions, highlighting his knowledge of both TCM and Western medicine, specifically related to endometriosis.
Yes, and there's another from Dr. David Hoffman at IVF Florida. He talks about Mike's professionalism and deep knowledge, even saying Mike knows more about reproductive endocrinology than many practicing REIs, which is quite a statement. Dr. Hoffman also mentioned Mike helped form a special board within the American Society of Acupuncturists to certify practitioners in REI reproductive endocrinology and infertility. So really cementing his impact. And then you see the patient testimonials too, constantly mentioning the compassionate care and, well, the effectiveness of the treatments.
Okay, so what makes the Berkeley Center stand out, really? Compared to other places offering complementary medicine, is there something key they've learned over those decades?
That's a really good question. And yeah, I think there is a key insight. Beyond being the first specialized center, that 27 years of focus has really shown them the crucial importance of consistency and timing with acupuncture. It's not just about getting acupuncture now and then for general wellness. It's about precise interventions at critical points in the cycle or during treatment like IVF. It's about recalibrating the body right when it needs it. This understanding, it comes from decades of seeing what works, refining their methods, developing those proprietary protocols, and seeing consistently positive outcomes. Their approach really blends the Eastern therapy seamlessly with the Western understanding, directly supporting treatments like IVF or IUI.
And those collaborative relationships with Western doctors you mentioned, that sounds like a huge part of their model too, building that bridge.
Absolutely crucial. They actively work with most of the well-known REIs in New York City, creates this cooperative environment. They often communicate directly with the REI about a patient's plan, making sure everything is cohesive, optimized, and they have specific acupuncture protocols designed to, say, improve egg quality or lining quality, enhance ovarian function, even decrease miscarriage rates, all tailored and backed by research where possible.
And one detail that really jumped out from the sources was the pre- and post-embryo transfer acupuncture. Offering that 7 days a week, that seems like significant support.
It really is. They recognized how critical that period is during IVF. So they make sure acupuncture is available 7 days a week, specifically for right before and right after the embryo transfer. And studies have shown that acupuncture done at those specific times can significantly boost pregnancy rates for women doing IVF. So having that readily available specialized care right then, it's huge support during a really sensitive time. And beyond that specific protocol, they offer a whole range of services. Personalized herbal medicine, low-level light therapy, programs focused on miscarriage prevention, telemedicine, even home visits sometimes.
It really does sound like a center that's made a big mark on the field, not just in practice, but in helping validate these approaches.
I think that's fair to say, yeah. Through their pioneering work, their consistency, they've definitely helped validate the role of complementary therapies, particularly acupuncture and herbs, showing they can be effective adjuncts to conventional fertility treatments. Developing their unique protocols and formulas has opened up new possibilities for patients facing all sorts of challenges: male factor, female factor, recurrent loss. And by building those strong relationships with Western doctors, by being active in the broader reproductive medicine community, they've genuinely helped bridge that gap between the Eastern and Western thinking, promoting a more holistic view of patient care. And finally, just making support accessible. That 7-day pre-post transfer service, telemedicine, home visits, it shows a real commitment to being there when patients need it most.
Wow, what a journey in this deep dive. It really seems clear that complementary therapies, like acupuncture and herbal medicine, they offer real promise. Promising adjuncts for managing endometriosis symptoms, maybe improving fertility outcomes, working by reducing inflammation, regulating hormones, enhancing overall reproductive health. Valuable support alongside the conventional stuff.
Absolutely. And it really underlines how important it is to talk to qualified professionals, get personalized plans, especially with herbs. And it also just highlights the value of this integrated approach, right? Bridging East and West. The Berkeley Center is such a clear example, the first in the U.S. focusing just on this, 27 years doing it. And their specific timed protocols like that 7-day pre- and post-transfer acupuncture. Studies suggest those can significantly increase IVF success rates. It's quite compelling.
So, taking a step back, what does all this mean for you, the listener? Maybe beyond just fertility. Think about the wider implications. How might understanding these principles of integrative care, you're combining ancient wisdom with modern science, how might that change how we look at other health challenges, not just fertility? And also, think about how these kinds of collaborations, like Mike Berkeley working closely with leading reproductive endocrinologists, could that become more standard in healthcare in the future? It really makes you wonder, doesn't it? What other complex health issues could really benefit from bringing these two worlds closer together?